They're doubling up in ICUs, so it's supposed to be one nurse to one patient. That patient is that unstable that their vitals have to be watched all the time. They're doubling up 2 to 1, sometimes even in the pediatric ICUs.
That doesn't sound safe.
No, it's completely not safe. Birthing units closed in places that are an hour and a half from the next hospital. Entire, services, vital services, all the inpatient beds in several hospitals have been closed down. That means everyone from that town has to go to the next town over and pile into the next hospital. And we don't have one iota of excess hospital capacity in Ontario. Well, it's funding and staff. There's sort of this two flip sides of the same coin. So, there's a couple of things. So a bed in a hospital, when we talk about beds, is a bed that's staffed and in operation. All across Ontario, they've closed so many hospital beds that we have the fewest hospital beds left, that's beds staffed and in operation, of any province in the country, by far. In fact, of the whole OECD, so every nation with a developed economy, as they call it on earth, the only countries with fewer hospital beds left than Ontario has are Mexico and Chile. All our peer countries have far more, some of them double per person, the number of hospital beds. So we're tens of thousands, like 15,000, 16,000 hospital beds short of what others, our peer countries, would have. As they've closed hospitals, every service closed at a hospital they privatize. So that's the drive to close hospitals and also to cut funding. But in addition, we had the pandemic, and the hospital staff, went through the first wave, the second wave, the third wave. And they started to get very, very burnt out. And so if they could retire out, they retired out. At the same time, the Ford government brought in wage caps that set wage increases at less than the rate of inflation. So economists call those real dollar cuts, like your wages don't even keep pace with inflation. And so people left. They left in droves, and they poured money into privatization. They've poured money into long-term care, the majority of which is privatized. They've poured money into private clinics. So yes, it's decimated the staff in the public health system. At the same time, they have tried to do a big shift of resources to the private for-profit parts of healthcare.